The main ones that are currently on the market for weight management are Wegovy and Zepbound. Now, the diabetes version of those is Ozempic and mounjaro. There's also Saxenda, and there's a variety of other GLP-1 medications that just didn't get the same claim to fame because they aren't nearly as effective on the weight loss side of it. But yeah, so what we have with those medications is essentially we're using them. They're a tool in our toolbox to help you to not only manage blood sugar levels, but also helping you to manage weight. Now, how much weight somebody loses, like on an average level, if we look at Wegovy at the top dose, it's about 15%, maybe higher, depending on which study you read and all the procedures and stuff. Zepbound, again, 21% is the average and such like that. There's going to be some people who lose more. There's going to be some people who lose less. There's some people who don't respond at all. Really, what we're looking at, and we start at a very slow dose, is to kind of manage the side effect components of things. So initially, there can be some primarily gastrointestinal or stomach side effects because your body needs to get used to that higher level of it. And in particular, it's slowing down that gastric emptying or how quickly food's going from the stomach to the small intestine. And so in slowing that process down, yeah, we can get some nausea, heartburn, rarely constipation or diarrhea. And those would be kind of the things that we need to look at there. But that whole process does speed up eventually as your body gets used to the medication. And so that will get better managed and will go away. The other big thing that I always tell people about is there is a risk of pancreatitis. It's a very, very small risk. And out of the thousands of people I have treated and put on these medications, I've yet to see a case of it come about.
Huh.
And even then, the pancreatitis component isn't necessarily the drug itself. What we're finding is it's actually because of rapid weight loss.
Mm.
When people lose weight very rapidly, it releases the fat into the bloodstream, and cholesterol is one of those fats. Cholesterol goes out of our body via the liver and our gallbladder. So that's what your bile is.
Mm.
Gets collected in there. And what happens if enough of it's there? It'll concentrate, crystallize, and create gallstones.
Mm.
Well, your pancreas and your gallstones have kind of the same tube that goes down to our intestine. And if those gallstones block that up, that makes your pancreas very, very cranky. That then leads to the pancreatitis. So
Mm.
if someone's worried about it, it's always a conversation of, we want to make sure you're losing weight at a reasonable rate, but not too rapidly. And if you're losing it rapidly, these are kind of the risks and things that we're concerned about.
Mhm.
Again, it's usually less than 1%. I would even say less than like 0.1%, but
Mm.
it is certainly a risk that's there. And that's the main other side effect that we're really concerned about with these medications.